COVID-19 cases around the world are still on the rise. Over 60 million people have gotten infected and more than 1.4 million have died. Some countries are seeing a decline while others are having second waves. But how is Asia doing, specifically the Western Pacific region, compared to the Americas and Europe? Well, with us this morning is Dr. Babatunde Olowokure. He is the Regional Emergencies Director for the World Health Organization's Western Pacific region. Doctor, good morning. Thank you so much for joining us here on New Day.
Thank you very much for your invitation.
Now, Doctor, COVID cases in Asia are fewer now compared to the Western region. What is the basis of this statement? How is it we're able to say that? And how would you describe the COVID situation in the Western Pacific region right now?
Thank you very much for that. It's a very good question. In this particular region, Western Pacific region of WHO, we have been able to keep our numbers down because many of our successful member states have responded very effectively. They responded very early, and they provided guidance for the population. Now, in the western parts of the world, what we are seeing is an increased or a surge amongst younger people in terms of cases. There has been increased testing, but that increased testing has also been associated with an increased positivity rate. And so therefore, we do know that this increase is real in the western part of the world. There's also been a lot of mobility. There's been mixing of populations, and there's been relaxation of the public health and social measures that were instituted. And we also have reports that the younger people themselves have indicated that they are not following or they're not in compliance with the hand washing and social distancing measures that have been encouraged.
Right, interesting, by their own admission. What do you think are the key factors in terms of that contribute to declining cases in Asia? Would you say a lot of it is the mask wearing? Because we know in the United States, mask wearing is such a controversial issue.
Sorry, could you repeat the question, please?
Yeah, how effective do you think mask wearing has been in Asia? Because in some countries in the West, particularly the United States, mask wearing is a very controversial issue there.
Yes, so thank you for that. So mask wearing is, as we know, it's very effective. So it does tend to prevent the person who is wearing the mask from giving it to other people. So in fact, when you wear a mask, what you are doing is preventing you giving the disease to other people. I'm not saying, of course, that everybody who wears a mask is infected. I mean, that is the whole point, is to wear a mask to prevent or to reduce the risk of infecting others. And so therefore you're wearing the mask for the safety of others. And so this is what we would really encourage. And this is what the evidence has shown, is that mask wearing does tend to reduce the transmission of the disease.
Doctor, here in the Philippines, what is your assessment of our COVID response?
So within the Philippines, I mean, the response to COVID-19 has been one that has been implemented with regards to ensuring that individuals protect themselves. And this is really, really important. And so therefore, compliance with hygiene measures, ensuring that people wear masks, and also social distancing being observed. These are the measures that we would really like to see people following. And we should remember that it's a disease which transmits from person to person. And so therefore, it's very important that communities as well as individuals ensure that this happens. So the protection of individuals is very important.
Certainly in the Philippines, we are doing better. We still have about under 2,000 cases a day. It's still better than what it was in previous months, but it's also not as good as some of our Southeast Asian neighbors. What else does the Philippines need to do in order to get to where, let's say, Thailand is?
I think what we should remember is that the challenges to the Philippines are not unique, but the Philippines also does face some particular challenges, including many people who were working and have lost their jobs and have come back from other countries. And also we have here in the Philippines, the storms, the floods, typhoons, which cause flooding, which cause people to congregate together in evacuation centers. So the government has taken early action to restrict movement, and so therefore this may have prevented much greater infection rates and saved many, many lives. So and again, I would just emphasize that again, there is also the need for individuals to continue to observe the social distancing as well as the hand hygiene, respiratory hygiene measures in order to protect themselves, their families, and their friends.
All right, that will prove to be a bit of a challenge during the holiday season. But thank you so much for your time this morning. We appreciate it. Dr. Babatunde Olowokure of the WHO's Western Pacific region.